Okay, good afternoon. I see people are hopping on. So as y'all hop on, I'll just introduce myself. Hi, everyone. Thank you all for joining today's webinar. My name is Diana Guevara, and I'm the Community Health Education Specialist for the Nourish program and a graduate of the Dietetic Internship Program at the Michael and Susan Dell Center for Healthy Living, housed within the UT Health Houston School of Public Health. Today's webinar is hosted by the Michael and Susan Dell Center for Healthy Living. The center's vision is healthy children and a healthy world, with a mission to advance health and healthy living for children and families through early and impactful interventions. So as people hop on, let's go ahead and share our screen, our slides.
So Diana, I lost the ability to between our practice and when we just went live. So trying to find how to do that.
All right, no problem. We still got people hopping on. So we've got some time to get that.
There we go. I was just provided access again, so we're good. Does everyone see that?
I can see it. So hopefully everyone else can. Awesome. All right, so thank you to the Michael and Susan Dell Foundation for providing funds to the center, including today's webinar, which is that next slide, the foundation. And in our next slide is information about our center's work and resources, which can be found online. You can scan the QR code on the screen, which will come up later, to access our health resources. Our center also leads the Texas Research to Policy Collaboration, Texas RPC for short, project, which creates the legislative related resources described on this slide, which you can scan the QR code to learn more about here as well. And today's webinar is held in conjunction with Diabetes Awareness Month, which serves to amplify awareness about diabetes, its impact on individuals and communities, and the importance of prevention and management. So it's the month of November, so we're still a couple days in. A couple of days left. Throughout this month, advocates, healthcare professionals, and communities unite to educate, support, and inspire action. So be sure to join us tomorrow for a discussion on the prevention and management of type 2 diabetes through the integration of cooking skills into nutrition education. And this is our presenter. So this webinar is held in partnership with the Nourish program. The Nourish program shows people how to grow, prepare, and promote food that encourages lifelong health and well-being through hands-on, evidence-based classes taught across our garden, kitchen, clinic, and community. We've also partnered with Old Ways. Old Ways is a nonprofit dedicated to improving public health by inspiring individuals and organizations to embrace the healthy, sustainable joys of the old ways of eating, heritage-based diets, high in taste, nourishment, sustainability, and joy. And our third partner today is Rewire Health. Rewire Health's mission is to empower individuals and communities to live healthier lives through equitable habit solutions. The female co-founders believe that better health can be achieved by creating simple, healthy eating habits. And after years of research, experimenting, and working with clients, they created Pursuit, a technology that personalized recipes and scales culinary medicine. And as a reminder, the slides and webinar recording will be archived on our website. And if you have any questions during the presentation, please enter them into the questions chat box. There will be a Q&A at the end of the presentation. And without further ado, I'm excited to introduce our speakers today, Olivia Thomas and Adante Hart. So here are, so sorry, let me get their wonderful bios up. Okay. So sorry, Olivia Thomas is the Nutrition Innovation and Implementation Director at Boston Medical Center in Boston, Massachusetts. In this role, Olivia leads a dynamic teaching kitchen program revolutionizing how healthcare providers approach nutrition interventions. Olivia is also an entrepreneur, working as the co-founder and chief innovation officer of Rewire Health. This cutting-edge culinary medicine platform simplifies healthy home cooking and expands access to teaching kitchens beyond the hospital setting. Olivia is helping pioneer culinary medicine by working as a culinary medicine consultant for Penn State Health and Columbia University, as well as co-chairing the Membership Strategy Committee of the Teaching Kitchen Collaborative and the American College of Lifestyle Medicine's Culinary Medicine Interest Group. She's a powerhouse. And Adante Hart is a registered dietitian, nutrition educator, speaker, and enthusiast of all things food, culture, and health. He strives to advance food sovereignty and increase community and individual agency over well-being and quality of life. Drawing from a wealth of experience working in and around food from academia, agriculture, farming, healthcare, restaurants, and nonprofits, Adante presents on topics that reside at the intersection of nutrition, accessibility, foodways, and health. He currently serves as an outreach dietitian for Old Ways and has served in various roles with Ruby Cooking School, the Southern Foodways Alliance, and National Organization for Blacks in Nutrition and Dietetics. Additionally, Adante serves as a team member of Tallgrass Food Box, a community-supported agriculture business that supports and encourages the sustainability of Black farmers in local food systems. He studied biology at the Johns Hopkins University and earned his Master's of Public Health at the University of North Carolina at Chapel Hill, where he also completed his coordinated program in dietetics. He currently resides in Durham, North Carolina, and enjoys all things food as well as technology, gaming, and media production. So without further ado, I'll go ahead and hand it off to Olivia.
Wonderful. Thank you so much for those intros, Diana. And thank you all so much for being here today. We're really excited to talk about culinary medicine and how everyone here can kind of start using it tomorrow. So what is culinary medicine? I'm going to take a step back and first answer what is food is medicine. And this is a term that's been used pretty frequently on many different platforms. And I want to start by saying that the idea that food is medicine or can be used medicinally is not a new concept. This is something that has been around for centuries and is a key part of many food cultures. However, what is new is incorporating the idea that food can be medicine into our modern day healthcare system. And so when we hear food is medicine today, we're referring to a combination of services that can help address not only healthy eating, but also access to healthy eating. And so here we have a pyramid that helps kind of map some of the services, and they go from prevention, so helping communities prevent chronic illness, to helping manage and treating diseases. And so you can find this pyramid. It was published by Tufts University, and it's used kind of to describe the movement. And so I'm going to talk about some of these services using the NIH's definition of food as medicine. And so here we have medically tailored meals, which are prescribing meals to people that help manage chronic illnesses or are medically appropriate for different disease states. We also have medically tailored and healthy food packages and groceries, so providing raw ingredients to prepare foods. This also includes vouchers and referrals, so helping people pay for healthy food products, prescriptions for nutritious groceries or produce, and then lastly, culinary medicine and teaching kitchen programs, which is really the application of the nutrition science into real food and behaviors. And so for today's webinar, we're going to be focusing on specifically culinary medicine. So many of you have probably heard the term culinary medicine, or maybe you've heard the culinary nutrition as the term. Both to us mean the same thing. And I have two formal definitions here, which I'll read. Culinary medicine is a field in medicine that blends the art of food and cooking with the science of medicine, whereas culinary nutrition is a field that blends the practice of applied nutrition science with culinary arts. So culinary medicine is more specific to medical practice and health systems, where culinary nutrition might be more of the umbrella term, but to us, they both kind of mean the same. And really, it's the practice of translating nutrition recommendations into real food and repeatable behaviors. And so people in the field like to use the analogy of riding a bicycle. And so when you want to learn to ride a bicycle, you learn by going outside and biking and falling and trying again and doing it again and doing it again. You don't learn to ride a bike by reading a pamphlet or getting a handout. Googling it online, I mean, maybe that's helpful for your knowledge, but actually doing it requires going outside, putting your helmet on and trying. And the same applies for healthy eating. We learn to eat well by tasting and trying and doing and kind of interacting with food. And so that's why we like to say that it's the translation of the recommendation. So here, right, we're recommended to eat 3 to 5 servings of whole grains a day. Great, I'm really excited to do that. But how do I do this? What does it taste like? Is it going to taste gross? How does it make me feel? Do I enjoy eating it? How can I make this easier? I don't have a lot of time. And those questions is where culinary medicine comes in as a way to help the application of the recommendation. And so letting people taste, smell, feel, ask questions, get involved helps really translate the recommendation to the behavior. And so culinary medicine can be used for many different types of people. It's used with staff and trainees, so staff wellness programs helping your staff live healthier lifestyles. Trainees, often like medical training, helping providers better understand nutrition and how to talk to patients about their food. Culinary medicine is used for adults and children. This can be in healthcare settings, like we talked about with the pyramid, with the prevention and management of diseases. It could be for community building, just bringing people together and connecting around food. And so whatever background you're coming from, culinary medicine likely fits, and it can be used to serve many different functions to an organization. So with that, I'm going to send it over to Adante, who will talk about person-centered culinary medicine. I can't hear you, Adante.
What about now? Can you all hear me?
Perfect.
Awesome. Thank you for the previous information, Olivia. And so, yeah, so Olivia just talked about what culinary medicine is and the purpose behind it. But we also want to keep in mind that at the center of all this, we're looking at, using culinary arts, food, medicine, nutrition. But we have to remember at the center of this is people. We're all here because there are communities, there are people that we serve and want to better serve through culinary medicine. So it's important to remember that us as the provider and our participants, we're working together to uh, solve problems in a collaborative effort. So it's not just, the practitioner has all the information. We also realize that the participant also has information and they're also aware and they're also part of the solution. So a key thing to remember is that the participant is always a part of the solution. They have things they bring to the table. They bring a wealth of knowledge. They bring experience. They bring knowledge of their culture, their favorite foods. And so it's always important to remember that this is a collaborative effort. It's not just all on one end. Next slide, please. And then before we go on to how to start a culinary medicine program, it's important to look at the 5 Ws. And the ones I want to talk about right now are, again, who and why. We just talked about how important it is to, it be person-centric. So always know who your audience is. Always just know, who it is you're serving. It could be one particular group of people. It could be a wide group of people. But we need to always focus on the who. And most importantly, we need to focus on why. Why are we doing these interventions? Why are we hosting these programs? Why are we opening a teaching kitchen? Why are we doing culinary medicine programs? It's important to keep that why at the forefront of everything you do, because the when, the where, the what, and the how, that comes later. But as long as you know the why and the who, that really serves as an anchor for any type of culinary medicine program that you do. Next slide. So as an example, there's a word on the screen, and that word is barbecue. Okay. So when you see this word, what comes to mind? I don't know if there's a chat, I can't see it, but what comes to mind when you see that word barbecue? All right. I know that people from different areas of the US and globally. So when some people see that word barbecue, some people may even say, well, why is there a Q and not a C? That's a whole other thing. Some people, if you're in Texas, you might think kind of a dry rub, might think of brisket, where if you're where I'm in North Carolina, you're thinking like a pulled pork with a vinegar-based barbecue sauce. If you're in Kansas City, barbecue is a whole different thing. And even if you don't eat meat, if you're vegan, there's vegan barbecue. So that brings things to mind. We think about sausage seasoning. So just as how we think of different things, we see the word barbecue, we talk about culinary medicine, we talk about food, we have to realize that the people we serve, they may see food differently. They may have their own different taste profiles and preferences. And when they come to the table, is people see things different way. And there's no right or wrong way to see things. So we talk about the recipe, for example. You might provide your participants with a recipe. It may not exactly be the authentic or the authoritative recipe for something, but that's okay. This is this variation of it. This is variation that we're using for the purposes of teaching, and we'll get some more of that later. So just keep in mind that perspective plays a role in all this. Next slide. And just as how perspective plays a role, we also must remember that there's no one size fits all approach to nutrition. Everyone has different preferences. Everyone has different things that they are working with, whether it's race, whether it's gender, whether it's socioeconomic status. There's no one size fits all approach to this. And we even see that we even look in particular groups. So let's look at African Americans, for example. It's you can't lump everyone in one category. So each group is not a monolith. So we always have to remember that when we think of recipes and foods and things we work on. There's always nuance within every group of people that we work with. So keep that in mind. There's nuance, and you can't do a one size fits all approach to everything, but we can adapt different things for different groups and different preferences. Next slide, please. So another thing you want to do is consider different learning styles when we're working with different people. Some people you can give them a list of foods to eat, and they take that list and they're like, all right, bet I'm going to go through this. I'm going to eat healthy or whatnot. For some people, it might take a different representation of that list, and for some people, it might even need to see what it looks like. So I have an example here. So always we have a number of heritage diet curriculum, and one of the first image you see, it's a list of foods that are part of the African heritage diet, which is a diet based on foods that are traditionally eaten across the African diaspora. It's a great list of showing foods that should be the base of the diet, followed by foods that are eaten less often and foods that are eaten sparingly. So if I gave this list to one person might be able to take this list and be able to really be like, okay, I can eat these every day. These are probably, like every other day foods, and these are probably special occasion foods. Whereas someone else might look at this list and like, well, what do I eat? So you look in the middle, we have what's called the African Heritage Diet Pyramid, and it's just a pictorial representation of that list. And it shows the foods at the base of the pyramid, which should be eaten more often, which are the greens, the whole grains, the fruits, the vegetables, etc. As you go up that pyramid, things that are eaten less frequently. And then for some people, they may need to see what it actually looks like on a plate. So we have different heritage plates that show what a balanced meal looks like from across different parts of the world. So just as there are different styles of, handouts, images, graphics, always have to consider the ways people learn and how people learn best. So usually when we're doing a program, it's best to have multiple of these so you can be able to reach people who learn differently. Next slide, please. And then another point I want to make is that if you're starting a culinary medicine program or you're sustaining it, remember you don't have to know everything. You don't have to have everything perfect to get started. With at Always, we worked with a bunch of subject matter experts to develop a lot of the resources, like you see, like the heritage diet pyramids over the years. So, we don't have all the answers, but our network, the people that we lean on, they have the answers. And so, next slide, please. And so, as an example, this is our African Heritage Diet Advisory Committee. It's filled with culinary historians, dietitians, public health experts. It's filled with historians and chefs, people you may even recognize from various areas are on this slide. And so this goes to show that, it might take leaning on subject matter experts and people who know the stuff that you want to find out or want to disseminate. So just remember, you don't have to have all the answers. You have a network, there are resources available, which we'll get to later. Next slide, please. And so some things to remember, again, people first, right? We're working with people, we're working with our participants, and we're working together to create a solution, right? So always remember it's people first, and remember there's always nuance. Nothing is ever monolithic, nothing is ever, one size fits all. So we have to remember there's nuance within groups, within food, everything. And then always remember the people we work with, they are assets. They have assets that they work with. They bring, again, a wealth of knowledge and experience to the table. So take it as an opportunity to learn from them as they're learning from us. And then finally, adapt, adapt, adapt. There's no one size fits all approach. You're going to have to adapt sometimes. You're going to have to maybe tweak a recipe because, the group you're working with, they may not, know what this food is or eat this food. So tweak it based on what people's preferences are and tweak it based on, your audience. And always, even, during COVID, we had to switch from physical to virtual like we're doing today. And if we didn't have to make that adaptation, we wouldn't even be on this webinar today. So always adapt when you can. Next. And finally, when it comes to just working with different people in this field, there's a quote I love from Michael Pollan, and it really gets to the heart of what this is about. He says, I've yet to hear of a traditional diet from any culture anywhere in the world that is not substantially healthier than the standard American diet. The more we honor cultural differences in eating, the healthier we will be. So again, back to our participants, the things they bring to the table, the different cultural differences in eating, looking across the world, every culture has things that they bring to the table that are healthy. So by embracing those traditional healthy foods, we ourselves will be healthier people.
Great. Thank you so much, Adante, for bringing up so many wonderful points. And so just to go over what we just talked about and then move on to our next section. So we defined culinary medicine as the application of nutrition science, which invites people to taste, feel, and connect with food. Adante reminded us that this needs to be people-centric and that all interventions, but specifically for this webinar, culinary interventions need to be created with the people we're working with. And so it should be a two-way conversation where the provider or educator works with the group that they're hoping to provide culinary medicine for to establish what they want to learn and how it can best be approached. So hopefully now we have a good understanding and background of culinary medicine. And so for the next 10 minutes or so, I'm going to go over 6 steps to get started tomorrow. So our goal is that everyone on this webinar is going to feel motivated and excited to start a program. And if you have a program, maybe you'll learn some new tips and tricks to improve the one that you've already started. And then in our last 10 minutes or so, Adante is going to lead us through a hands-on cooking demonstration, which I know is why you're all here. So I'll try to go as fast as I can. So our first kind of step is to investigate what programs already exist. And so there is a movement, there is the Food is Medicine movement, and there are programs that have been established a long time ago or that are popping up now. And so the first step is to see what's around you before you create something new. And so these are 3 platforms that are really helpful to do that. They are resources related to social determinants of health based on zip code. And so I'm going to walk through findhelp.org because that's the one I often use, but all 3 of these are wonderful. And so here is findhelp.org. You type in your zip code, and then you'll be provided a list of resources available to you based on that geographic location. And so I urge all of you to head over to the website, put in your zip code, and see what food resources are around you. And it doesn't mean you have to look for a culinary medicine program, but maybe look for local food pantries or kind of community eating programs or food prescription programs. And maybe that's a great place for you to start as a partner, but maybe you will find some culinary medicine programs. But I urge all of you to check out what's near you. And another great resource is the Food is Medicine map produced by the Teaching Kitchen Collaborative, which maps food is medicine resources and culinary medicine programs across the world. So in this picture, it looks a little US centric, but the map is global. And you can look and see if there's programs around you. And so that's another great resource to just see what exists so you don't have to reinvent the wheel. Second step, assemble your team. And so Hopefully, we get the point across that you don't have to be an expert on everything to start a program. You just need to be comfortable to talking with people and working with people, and the rest will come. In healthcare settings, oftentimes culinary medicine programs are led by doctors, nurses, dietitians, health coaches, and then really there's a whole array of different experts. So you can have farmers and exercise specialists, social workers, volunteers, students, administrators, researchers, tons and tons of different people getting involved in this work. I do want to shout out dietitians, maybe because I am a dietitian, but also I am confident that dietitians have the skills to lead programs and start programs on their own. Within the dietetics field, dietitians learn about food, they learn about coaching and working with people, they learn about that translation, and so they're really wonderful candidates to start a program. And so if you are a dietitian on this call, I hope you feel encouraged to go out and start a program. And if you are not a dietitian, I hope this encourages you to network with dietitians in your area or in your institution, because they are likely great assets to help you bring this idea to fruition. So this is a paper we published on dietitians working and leading teaching kitchens, and it is interprofessional by nature, and so I by no means want to not attribute other wonderful players in the field, but dietitians really are great candidates. And so here's a paper you can read more about how dietitians are doing this work and maybe use it as evidence when you're making an argument at your institution. All right, so 1, you're gonna see what's around you. 2, you're gonna build your team. You're gonna see what gaps like you might feel you need fulfilled. So maybe if you're a dietitian, you wanna work with a chef, or maybe if you're a doctor, you wanna work with a dietitian. See who you need, assemble your team. And the 3rd step here is to establish your teaching kitchen. So culinary medicine is a practice. Teaching kitchen is the place where it's practiced. And one of my colleagues likes to say, if you've seen one teaching kitchen, you've seen one teaching kitchen. They all look different, and there's many different ways you can go about it. And so here are a few ideas, especially to just get started. So you can have a teaching kitchen without a kitchen. You can do it in a conference room or in an office. Really, you just need a few kitchen tools, and you have yourself a teaching kitchen. You could do it virtually from home. So this is a close-up of my setup. We'll see a Dante setup in a little bit, but you could just Zoom people into your home kitchen and offer a class. There are pop-up models. You can buy pop-up carts, and you can bring your kitchen around your organization and serve maybe staff and then patients or community members, or bring it to the food pantry. Those are really nice mobile options. And then lastly, you can build kind of a large teaching kitchen. And here's a picture of one at Boston Medical Center, which is right within our hospital system and has these beautiful glass doors. So this whole spectrum of kitchens work. You'll just choose one that fits you. And so to reiterate how easy it is to start a teaching kitchen, this is all you need. So first, some safety equipment. So making sure you have a clean, sanitized surface, your hands are nice and clean. That's the key. So sanitation first. Secondly, a few basic kitchen equipment. So maybe a bowl, maybe some measuring spoons, maybe a jar to shake up a dressing. That's it. Then, if you're feeling really spicy and you really want to make something crazy, you could add some heat. So using like a hot plate, an electric kettle for hot water. You could have a blender to make some smoothies. And those are really nice to have, but honestly, you could do it with less, and we've done it with less. This spring with a colleague, we led a culinary medicine training for a group of people, and it was 100 people in a conference room, and it was just bowls and cutting boards, and we made a lot of delicious food. So it definitely can be done. If you want to take on the virtual option, again, you don't need a lot of equipment. You can start honestly with probably what you already have. So this is my setup. You can use a laptop, and I use that often to like look at participants on Zoom or on the platform I'm working on. I use my phone as the frontal view, so making sure people can see me head on. I do like having a camera over my hands, and so I use a document camera. That's what's there. It's a little bit expensive, but you can honestly use your camera on your laptop and then use your cell phone overhead and capture your hands using a tripod. So lots of different options there. And if you feel really nervous about having a live class at first, maybe start with some pre-recorded videos and have them on your website, on your social media, have them available to people. but sometimes that helps make it a little easier than starting with the live virtual classes. So 4 is curate your content. And so when we talk about content, we always, like Adante said, start with who are we serving? What do we need to build? We want to make sure we have established some aims and outcomes. So what is our goal of the class? What are we hoping people will leave with? This often then helps build a lesson plan. So what are we going to teach? Then we need some resources like recipes or handouts or kind of things to help bring takeaways to the class. And then lastly, evaluate. We always want to understand if what we've done was effective, was helpful, was enjoyable, because what is it all for if people aren't enjoying it at the very least, and then maybe learning and growing from the experience. And the great thing about culinary medicine is your recipe is your lesson plan. So the ingredients, they translate nutrition science to real foods. We're recommending 3 fruits and vegetables. Guess what? This recipe has that in it. Like, you can translate that recommendation to a meal immediately. And then your instructions are the skills needed to apply the recommendation into daily living. So is it roasting vegetables so vegetables taste better so you eat them more frequently? Is it the way you cook whole grains? So skills and ingredients, those are the 2 pieces that make it a successful culinary medicine class or program. And so here are a couple resources we're going to go over that can help you start building your content. This was a great book, The Complete Recipe Writing Guide, which helps you develop your own recipe content. I'm using it in a class I'm teaching as a textbook. It's a wonderful resource to learn more about creating and curating your own recipes and content related to nutrition. Rewire Health. So this is a digital platform that helps people build skills by repeating and practicing the same cooking skills over and over again. We know practice is what really leads to behavior change. And what's cool about the technology is it can be personalizable based on your personal food preferences and access. So every recipe can be adapted. We use multimedia resources, so there's videos, text, there's tons of different ways to engage with the material, and it is offered in multiple languages. So you can check out the app by going to rewirehealth.com. And I'm going to pass this over back to Adante to talk about overlays.
All right. So yeah, so always we have a number of resources for clinicians, dietitians, community workers, wherever you find yourself, we have resources for you around cultural eating and healthy eating. We have a plethora of things from handouts to brochures. If you want to teach a heritage diet cooking class, we have handouts on how to shop for a class, how to set up for a class. We have a great media kit, not a media kit, a media kit. If you want to maybe do a class, you don't really want to do a full class, but you want to get a feel for how the community respond to it. We have resources for you to do like a sample class for that as well. We have posters, pyramids. We have things that are a lot of free resources, some paid resources, and also we have a number of webinars for continuing education if you want to learn more about this intersection of kind of culture, health, and traditional eating. So I encourage you all to check out the Always website.
Perfect, and now I'll pass it back to Diana to talk about UT Health's Nourish Toolkit.
Okay, so throughout the years, with some grant funds, we've actually created a curriculum for people living with diabetes. It's offered in English and Spanish, and it's actually completely free to access on our website. So you see here, this is just a screenshot from our website. Just go to Toolkit, and then on the next slide, we can see all of the resources that we actually created. So along with just classes, we actually created a virtual culinary medicine toolkit, which has handouts that people can write on. We have handouts on specific cooking techniques, knife skills, etc. And then we also have animated videos related to specific topics, health topics. So this is for diabetes, so high blood sugar, low blood sugar, mindful eating. So a wealth of information. And then if you go to the next slide, you can see we also have kind of live action videos where we teach different cooking techniques. So if you want a video on roasting, if you need a video on sauteing, knife skills, we have those as well. And then I actually, in this last round, recorded the full class, the 5-session courses that we teach, in like a live, pause here to finish your onion type method. So those are also available on our website, again, completely free for you to use. I would love for them to be used because we put a lot of work into it. So just let us know how it goes if you do use it.
Awesome. Thank you so much, Diana. I use your website all the time in my practice. So both of them are wonderful resources. All right, so I have 2 more steps, and then we'll get to Adante's hands-on cooking demonstration, which is, of course, the most exciting part. So 5, explore funding opportunities. So hopefully we've convinced you that you're the right person to lead your culinary medicine program, that you can do it with very little resources. You can do it online. You don't need a physical space. You don't need a lot of cooking equipment. You can use, minimal foods, especially if you're doing it online and you just need to prepare that one meal. So hopefully you've been encouraged and feel confident that you can take that on. There are some ways you can expand your resources to expand your program. And so internally funding is often how we all start. We use percentage of our work time, our FTE, to put towards a culinary medicine component. So maybe I'm teaching a group class as a dietitian, or maybe I'm partnering kind of with an organization that has some resources available to them. For building a program, a little bit more of a robust program, philanthropy dollars is a great way to start. So applying for grants or local fundraisers, or talking to your development office to see if there's any rich people in your network that want to donate towards a great culinary medicine program. But looking for philanthropy dollars is great, like seed funding to get a program started. Community benefits, so oftentimes, especially public health or kind of federal hospitals, they offer a population health initiative, and they are required to put money towards preventing diseases in communities. And so within those buckets of money, sometimes there could be some funds that could be allocated for culinary medicine programs. So especially if you're a safety net hospital or a public hospital, seeing where the community benefits are going and seeing if there are resources there that you could use towards a class or a program. Same with employee health and employee benefits. Oftentimes, institutions, organizations, companies will put money towards their employee health. And so maybe within that funding, there could be some allocated towards a program. Insurance benefits, so working with insurance providers to offer classes. And then lastly is medical billing. So in healthcare settings, group classes can be billed. This is a bit complicated, and there's tons of webinars on how to go about billing and medical billing. It's great to show value of your program. It's wonderful for sustainability, but it's not always the most profitable mechanism. It requires a lot of work, a lot of documentation. And so I do encourage you, if you're in a healthcare setting, to explore medical billing, but I wouldn't start there. I would find some more easier, accessible dollars first, and then work your way up to billing for classes. And then lastly, step 6 is join professional groups and consider further training. So again, if you connect with people, you probably are a great person to lead a culinary medicine program. But if you would like more training, there are programs out there. I know Health Meets Food has one, Harvard Medical School has one, where you can learn more about culinary medicine, about culinary skills, and you can help develop a more robust understanding of the field and how to practice. There are tons of professional groups like the Teaching Kitchen Collaborative, ACLM, or the American College of Lifestyle Medicine, and the Culinary Nutrition Collaborative for dietitians. These are great organizations with like-minded people doing this work, and they're great to connect with and learn from. So join these groups, network within these groups, and find people who are doing this work also that you can learn from, work with, and collaborate. And for these 6 steps, we did write a blog post about it. So you can scan this QR code and head over to the blog post where it has all of these resources linked for your access. And with that, we're done. We made it to the cooking demonstration. I'll bring it back over to Adante, who will walk us through this recipe.
All right. Can you all hear me? Great.
Yes.
Let me just get my camera going. I'm gonna switch cameras shortly, but I'll get on camera first. So thank you so much, Olivia, for that amazing how-to from start to finish of how to start a culinary medicine program. I think it provided a lot of value. And we talk about educating and providing value to our, participants, people we work with. Again, handouts are great, right? Images are great, but people love to eat. And when you do a program, it's always best to have some sort of component, whether it's cooking or tasting, so that people can actually try these foods we're talking about. Because it's one thing for you to tell them, hey, eat a little healthier, eat this. It's another thing for you to show them what it looks like or how it's prepared, but it's a whole other thing for them to actually get hands-on, preparing it themselves, tasting it, and enjoying it themselves, and to be able to replicate those skills when they get home after the class. And so what I want to do today is do a little demonstration of a recipe. This is actually from one of Always a Taste of African Heritage curricula, and this is for a cold black eyed pea salad. All right, so it's one of the favorites of people who've taken this, who participated in this program. And it's a very simple recipe. Today, this is a no cook recipe, so no heating element involved. This is something else to consider when you're doing a program. I think Olivia touched on it. You may not want to do something with heat or lots of fancy equipment. Today we just got bowls, a cutting board, and a knife, and you're kind of taking it back to the basics. All right, so it's a great recipe for that. And this recipe, we use black eyed peas, but again, people have different taste preferences. People like different things. Some people love black eyed peas. I love black eyed peas. All right, I eat it at the beginning of the year and eat it throughout the year. Some people may not love black eyed peas. However, they might like chickpeas or garbanzo beans. They might like red beans. They might like black beans. So a beautiful part about a recipe like this is that you can interchange some of the ingredients. And so we talk about adaptability. We also encourage adapting recipes for, people may have certain taste preferences, or there may be foods that they either don't like to eat or cannot eat for various reasons. All right, so always important when you're thinking of recipes to do for a program or a class, think of how you can adapt it for different audiences, different preferences, and different conditions. Okay, so I'm going to switch cameras here. Is there anything else I wanted to talk about this recipe? Oh, yes, yes. Another thing I want to mention about this recipe is that for this black eyed pea salad, you see the ingredients right there. Again, you can change out some of these ingredients. So we've got black eyed peas, cucumber, red bell pepper, and jalapeno. For this time, I'm actually adding some diced red onion to this because I like the taste of red onions in a salad. So I'm doing that. It may not be on the recipe, but guess what? I've done this before, and it's really good with red onions. So when it goes back to, working with the participants and, being person centric, people you're working with, they may have a suggestion for something to add to it that actually might make the dish taste a little better. So let's listen and again collaborate and do this thing together. So I'm adding diced red onion to this, and then for the vinaigrette, that's another thing that you can change up. You see the ingredients right there, but if someone doesn't like, I don't know, honey or Dijon mustard, you can switch some things out. You don't have to put a shallot in there. I couldn't find a shallot at the store yesterday, so I don't have a shallot, hence the red onion. So you can move things, even with the herbs and spices. If you don't like cumin, guess what? You don't have to put cumin in there. All right, and you can relay this to your participants. They don't, if there's a spice they really don't like, they can switch it out for something else that they do prefer. Because the point of this is that we want to get them cooking and eating foods that they're going to love and enjoy. Because guess what? If the food doesn't taste good to them, guess they're not going to eat it. All right, we want to eat food that tastes good, that pleases us, and so it's always important to keep that flavor at the forefront. And with that said, I'm going to switch my camera here and show you all how to make this lovely salad. Just a moment. Okay. And we're going to switch this one. Cool. You all see me?
Yes,
Great.
perfect.
Awesome. All right, so for this salad, again, we have our black eyed peas, and so let's see if I can show you. I got canned black eyed peas in the store. You can use dry and soak them and whatever, or use frozen. There's nothing wrong with canned foods. When you're doing a class, it's also a good teaching point. canned foods are just as good as regular, conventional foods. With these, you do have to be mindful of the sodium, but you just simply rinse them, and kind of, sodium does become an issue. Okay, so nothing wrong with canned foods at all. So I'm using canned black-eyed peas for this dish. I also, again, when I talk about, modifying and adapting, I'm also adding corn because I like this with corn. Okay, and also adding some red onion. Um, and we're also adding diced cucumber. And a beautiful thing about a recipe like this is that there's different cooking skills that are actually showcased by this. So for this, I've already done a lot of the prep work, but for the cucumbers, the onions, the peppers, we had to do a lot of, not a lot, but a fair amount of chopping and dicing. So, we're building up those skills. We bring in knife skills, how to properly handle a knife, a cutting board. Again, those basic skills for cooking for yourself, so people have that agency and be able to make their own meals. And so we focus on the chopping and the cutting. And when it comes to making the vinaigrette, all right, so we're adding things together in this, and we're teaching how to whisk, we're teaching how to flavor foods without a whole lot of salt, without a whole lot of sodium. We're using herbs and spices, and also we're flavoring foods with acid. So this vinaigrette, uses apple cider vinegar and lime juice. So using that acid to provide some strong flavor as opposed to salt, which some people, kind of go for kind of instinctively, right? So those are the kind of techniques we're going to be covering in this recipe. And so there are a few things that I didn't do. So I got a jalapeno pepper here. I'm going to chop those up. And another point I wanted to make with these, jalapenos, they're spicy. For some people, they're super spicy. For some people, they're not that spicy. But again, people's preferences and tolerances to heat, they differ. So for this, if you wanted to use jalapenos, you could. And when I'm cutting this, I'm just going to cut down the middle because the heat is where the seeds are, where most of the heat is. Okay, so if I just kind of cut that seed pod out, that takes away a good amount of the heat. All right, so it doesn't make it fully mild, but it does cut down the heat. And another thing to note when you're doing this in a class, you might want to wear gloves, or just don't touch your eyes or face after cutting peppers. I have learned that lesson the hard way, and I don't want you all to have to learn that the hard way either. So I'm just gonna take these and cut them up, line them all up. Okay. And kind of keep them roughly around the same size. They don't have to be perfect. Again, we're going for progress, not perfection. And just it's a pretty decent size right there. All right, we're not working a Michelin star restaurant. Not everything has to be exactly the same size. Again, because we're going to eat this and it's going to taste good. All right, so put my jalapenos aside for now. Okay. And I think I'm actually done with the cutting board because I've done a lot of this cutting earlier. So I'm going to move this out of the way. All right. I'm done with this. Move this out of the way for a second. So we're going to make our dressing. Okay. We'll do that first. Because again, you just throw this together and you should let it marinate for a bit, but you don't have to. You can also warm the salad up later on if you want that. All right, so first we have a couple tablespoons apple cider vinegar. Now I, again, haven't done this recipe a number of times. I can kind of eyeball a couple of tablespoons, but for the purposes of this webinar, I'm going to measure this out. And again, this is another teaching moment when if you're doing a culinary medicine program, is kind of teaching about measuring what a tablespoon is, what a teaspoon is. So a couple tablespoons of apple cider vinegar. I'll move that out of the way. Okay. And we got the juice of one lime, and I actually forgot to cut this lime in half, so I'm gonna just cut this real quick. All right. So we've got our lime, juice that. You could just squeeze this by hand, or if you have one of those fancy schmancy citrus squeezers, you can also use one of those. But again, we realize that not everyone has a fancy schmancy citrus squeezer, right? If you have one, cool. If you don't, that's okay, because we can use our hands to squeeze this lime. Okay. All right, that's about juice of one lime right there. All right, and always have a towel on hand. Always important to have a towel. Dry off. All right, we're going to add some Dijon mustard, or I have honey mustard here. Again, use what you have. Works just as fine. So a little more there of mustard. Okay. Going to add some honey, some actually local honey here. Doesn't have to be local. This is what I have on hand. So add that to sweeten it. And again, you can modify this based on the flavors you like, the flavors your participants like. So if you don't like honey, you don't have to add honey. If you don't like your dressings with a hint of sweetness to it, that's okay. So we got our honey here, and we got some oil. So do a 1/4 cup tablespoons. Okay. Add that to our bowl. Also add some spices. We got some cumin, get some earthiness to our dish, and we got some cayenne for some heat. Now again, some people don't tolerate a lot of heat, so you can always omit that if you choose, but it's your choice. I like spicy foods, so I am going to use the cayenne and the jalapeno. And then I'm just gonna just mix this together. Now you can also throw this in a blender or food processor if you want, or you just throw this in a jar and shake it up. You don't have to do too much to it. That's good enough right there. All right. So I'm gonna put that aside for a moment and get another bowl, and we're gonna add the rest of our ingredients. Okay. So we're gonna add our black eyed peas. That's 2 cans worth of black eyed peas. Add my bell pepper. I used a red one. You can use a red one, a green one, a yellow one, whatever you choose. Add my cucumber. I'm not sure if you noticed this, but we got a lot of colors going on in this bowl here. So we got our black eyed peas with some brownish. We got our red bell pepper. We've got the green in the cucumbers. We've got kind of the reddish purple of these red onions. And I could talk about the nutritional benefits of it all, but that is not a conversation for today. That's a conversation you can actually have when you're teaching a culinary medicine class. And I got some corn here. So the whole adage of eat the rainbow, we got that going on in this dish. Add my jalapenos. And let me just get a spoon to put this together. All right. We got there. And we're not done yet. We're not done yet. All right, so that's the base of our salad. And then back to our dressing, I forgot a very important thing. All right, salt and pepper. So I'm gonna add some crackling pepper. I'm using a pepper mill. You can just use already ground black pepper. And then I got some salt here. My kosher salt. I'm gonna add that to it. Whisk that again. All right. Then I'm gonna pour this over. I'm gonna pour that over. I'll give it another good stir. And you should let this sit for at least 20, 30 minutes just so these vegetables can kind of marinate in that dressing for a bit. But if you're hungry like I am, you can go ahead and eat this now. All right. So there you have it. Fix this up a little more. And we have this beautiful and nutritious, but most importantly, delicious black eyed pea salad. And you can garnish this with some cilantro if you want. There we go. And depending on how many people that you're serving in your class, you can scale this recipe up or down, which is a beautiful part about something like this. So yeah, there you go. This recipe is from Always a Taste of African Heritage program. Not sure if you can see that there. There we go. So with that, thank you. Give it
Dante,
back to Olivia. Thank you.
All right, thank you both, Olivia and Adante. That was so fun. Y'all are amazing and wonderful in this field, so we're very lucky to hear from you both. We have about 5 minutes for questions, and we've got a couple already queued up in the chat box, but if you guys have any other questions, you can definitely type them in the chat box, and we'll try to get through as many as we can. So the first question, just kind of a quick and easy, do teaching kitchens require health inspection certification if doing it in person?
That's a great question. Always check with your organization and whatever governing body you report to, even if it's your state or your town. It changes geographically. So in some places there's really no regulation, in others there are. But oftentimes it's shared meals. It's not necessarily cooking, especially if you're not using hot cooking. So you can kind of work around requirements by calling it more of like a prepared snack than a meal.
Awesome, great. All right, so we had a couple of questions on our resources and our curriculums. So I'll kind of combine two questions in one. One person asked, the resources in the toolkit and others in Old Ways and UT Health, can those be used without individual permissions in workshops, classroom settings, etc.? And then how can we access the curriculum? Can the CHW or health educator impart the curriculum for agencies that may not have or cannot afford a nutritionist or a dietitian? So I'll speak to the UT Health and then I'll let Adante speak to the Old Ways. So the items on our website, they're open access, completely free to use. I personally would love just to hear how it goes, but that's just me personally. If you are doing any sort of research and you're publishing, we would love for you to cite us. Our toolkit, our virtual culinary medicine toolkit, it's a kind of in the process of hopefully getting published. So if you do any research, then we would love for citations. But other than that, it's up on the website for y'all to use. And then I'll hand it on to Adante to talk about Old Ways because they're a little different.
Yeah, thank you. Yeah, so on the Always web store, as I mentioned, we have a lot of free resources, again, from handouts to graphics to infographics. We even have CEU webinars that we offer for free. When it comes to the curricula, it's a little different. For the curricula, we do license them out. All right, so whether it's the African Heritage curricula or the Latin American Heritage curricula, it is on a license base. You can do the digital version, or you can get paper copies, and all that information is on the web store. The license is for a year, and with that, you can use it for your different classes, your different groups. And of course, if you had a print version, you can use those where you're at. So yeah, it's a little different, but we're a nonprofit. We're doing our best, and so we don't charge an arm and a leg. It's a very nominal fee for organizations, but we also encourage organizations that if finances are an issue, we always encourage to find other groups to work with. Maybe you do a class in collaboration so that the cost of that license isn't as great as it was if you'd be doing it by yourself. So we always encourage collaboration, finding groups or finding institutions that you can partner with to help absorb some of that cost of that license if it's that's an issue. So those are what we recommend.
And then I just want to pull it back to, can a CHW or health educator impart the curriculum for agencies that may not have or cannot afford a nutritionist or a dietitian? So as a dietitian, I would just say, you can definitely, as a CHW or health educator, you have a little bit of that nutrition knowledge, but always refer to a dietitian if you can for those very specific questions. So every time we teach, general classes, you can be very general with information, but always keep in mind that you can refer to a dietitian when they ask those very specific questions. We are at the 1 o'clock mark, so I don't want to take anyone's time, but if you do want to hop on, stay on for a little bit longer, maybe we can take one more question. What do y'all think? Yeah. All right.
Yeah, that's right. Can I go back to that last comment? Some people they look at a program like this and they think, oh, I'm not a dietitian, I'm not a nurse, I'm not I'm not this or that. Like, I don't know if I can do it. Don't let that be a barrier. As Diana said, there are specific questions that require the expertise of a dietitian. You just say, hey, I don't know, but I would recommend you speak to a dietitian. So there are things that you all here are good at, are great at, and know very well. So don't let a certification, I think, be a barrier to teaching a culinary medicine program. The important part is working with the people. All right. If you have those people skills, you can't really teach that. All right. So if you have those people skills, that is a great thing to work with. And again, if there are specific questions about health or condition, that's when you can refer to a dietitian or other clinician.
All right, so the last question we'll take is there a certification for medical nutrition? Like there's a CHEST certification, is there something for food? And then are there any webinars on billing or websites or any other resources? So we can definitely share any other resources that we can come up with in our follow-up email, but anything y'all want to kind of finalize and touch on?
I think the certifications are good for job competitiveness. So as someone who runs a culinary medicine program at a hospital, someone who has a certification will maybe make them a better candidate, but also life experience. I'm someone who was a live-in nanny and chef and worked as in restaurants my whole life, and so I don't have a certification in culinary medicine specifically. So I think if it makes you feel more confident or you would like it for competitiveness and job seeking, then yes. But like Adante said, it's mostly about connecting with people with food, which that's the skill that you can't teach and that if you have, you should use.
Agreed.
All right, wonderful. Well, thank you all for attending today's webinar. The recording and slides will be posted on our website, linked in the chat within 2 weeks. We appreciate you all being here, and we really appreciate you, Olivia and Adante, for sharing your expertise and wonderful advice. And then we'll see you all tomorrow if you're interested for another nutrition-focused webinar presented by UT Health Houston's Dr. Natalia Heredia. Prevention and management of type 2 diabetes through the integration of cooking skills into nutrition education. Thank you all so much.
Take care, everybody.